So you can also see the larynx on this picture. So again, everything that is below the epiglottis and the hyoid bone is considered your larynx. So you've got your Adam's apple or your thyroid cartilage here, and we'll look at these in the next slide. But it's basically where your voice is produced. And then below that is the tube that goes into your lungs, which is the trachea. So the next picture here is the cartilages in your larynx. And all of these cartilages are covered by muscle and soft tissue. So they wouldn't look like this in the body. You would have to clean off all the muscle and soft tissue. But this is an anterior view. So here is your epiglottis. And again, we looked at the epiglottis. Sorry, I don't know if I did look at the epiglottis, but the epiglottis is right here. And it's the flap that comes down and closes over your trachea when you swallow, so that food will go down your esophagus instead of your trachea here. So the tube in the front in your throat is the trachea, and then the tube in the back of your throat here is the esophagus. And the esophagus is able to expand, so which is why it looks so small here. And then the trachea, you'll see right here, it's got these rings. These are just cross sections of the rings that help keep it open. So if you have trouble remembering which one is in front, just think of like a tracheostomy. They just make a little incision between the cricoid cartilage and these tracheal rings, and they will just right under the skin be able to pierce through the trachea and put in an artificial airway. So again, this is the larynx and then the trachea. So here's our epiglottis, and this is from the posterior view. This is what it looks like. And if we have these big larynx models in the lab, but this little epiglottis can bounce up and down in the lab. It's like a little springboard, a little diving board. And this bone right here, this is your hyoid bone. So this is the only piece of bone in this entire model or this entire structure here. So everything else is either cartilage or soft tissue or membranes or muscle, ligaments. So the hyoid bone here. And this is a membrane here that's going to connect the hyoid bone to this big, huge cartilage here, which is called the thyroid cartilage. And this point of the thyroid cartilage is called the laryngeal prominence. So the laryngeal prominence is basically where your Adam's apple sticks out. So your laryngeal prominence, depending on how big it is how far your Adam's apple sticks out. So males, people born male, usually have a larger, more prominent laryngeal prominence than women do. And that is also another reason why men have deeper voices, and I'll show you that, how that's why that's the case there. So this is the back side of the thyroid cartilage. So you notice the thyroid cartilage doesn't go all the way around. It's only like a half moon shape here. There will be membranes that run along the back side here. And then you notice that we have a cartilage that does go all the way around right down here. So this first cartilage right here, you can see where it goes all the way around the back. This is called the cricoid cartilage. And this is the only cartilage of the larynx that forms a complete circle. And so if you are familiar with how a patient is intubated, you know that they apply cricoid cartilage pressure or cricoid pressure. And the reason they do that is this view right here. Here's the cricoid cartilage. If it goes all the way around, if they push it down, then it closes off the esophagus. So the intubation tube or the little scope they put down there can go into the trachea instead of down into the esophagus. It's not a life-threatening thing if they do get into the esophagus. It just is in a critical situation. It's a time thing. So then as we go down the trachea, we have these tracheal cartilages. And these tracheal cartilages don't go all the way around either. They have a membrane in the back which allows for food to pass down the esophagus. So this esophagus expands and allows for this back wall of the trachea to come in a little bit to allow for food to travel down the esophagus. So what else do you need to know from this picture? You need to know these little cartilages in the back. This cartilage right here, and I'll see if I can find a picture that doesn't have the muscle in it, is called the arytenoid cartilage. And there is a little horn-shaped cartilage on top of it, which is called the corniculate cartilage. So let me switch PowerPoints here and see if I can find a better picture. So this is my PowerPoint. And I don't have a better picture here. Unfortunately, I've never had to test off of pictures on this. I've always been able to use a model. So let me see if I can find a picture of a model. Okay, so here is a picture of the model that is similar in our lab, and you'll probably see something similar maybe on the quizzes. So this is the back side here again. So here's this thyroid cartilage, the cricoid cartilage, the the tracheal cartilages, the epiglottis, and we have these two cartilages right here, which are the arytenoid cartilages. And then on the top of the arytenoid cartilages, there's these little teeny corniculate cartilages. And some people think they look like little tiny candy corns. And this one looks like a big A. So arytenoid are the bigger ones. And then corniculate are the little ones right on top here. So from the front, this is the hyoid bone. This is the epiglottis, the thyroid cartilage. The laryngeal prominence would be right here. Again, the cricoid cartilage and the laryngeal, I keep saying that, the tracheal cartilages. Okay, so this view right here is looking down from the top of the larynx. So if you were looking down at somebody's throat with a scope, this is what you would be seeing. So you would be seeing something that does not look this nice, but this is what it would look like. And this is what's underneath all of this. So this is with all the soft tissue and the membranes and everything attached to those cartilages that we already talked about. So this is the laryngeal prominence right here. These are the arytenoid cartilages, and these little ones on top are the corniculate cartilages. And you'll see that there are actually ligaments that span from the inside of the laryngeal prominence to the arytenoid cartilages specifically. And the arytenoid cartilages form a joint here with the cricoid cartilage, and they are able to move back and forth. There are muscles attached back here too that we use to speak. So the ones on the inside here, and if you were to look at it from a side view, these inside ones would be a little bit lower down in the throat as well. These are the vocal ligaments, and these ones that are a little bit up higher and a little bit more to the side are the vestibular ligaments. So I'm going to switch to a different view here and show you this from the side. So this grainy picture here is showing you that view from the side. So you were looking down into the larynx from the top. And this first piece you see right here is where the vestibular ligament is, and it's covered by a membrane. So when it's covered by a membrane, it looks like this from the side. So we have this first fold coming out, which is the vestibular fold, and the fold is basically the membrane that covers those ligaments. So those ligaments get buried in the membrane. So when you're seeing the fold here, what we're referring to is the actual membrane that covers the ligament. So the vestibular ligaments and folds are otherwise known as the false vocal cords, and their purpose is to protect the true vocal cords, which are a little bit deeper. And the true vocal cord is, and the ligament, so the ligament itself, we usually call them the cord, but the ligament itself is the vocal ligament, and then it is also covered by a membrane, and it becomes the vocal fold. So here, the vocal fold comes out here. So this view right here, the one on the top is the vestibular fold, and the one on the bottom is the vocal fold. So the difference between the glottis and the rima glottis is the rima glottis is basically just the space between the vocal folds. So it's just a negative space. It's like your pupil or the vestibule of your nose. It's just the opening here. So it changes its shape based on the opening here. So a more narrow rima glottis will create a higher pitched sound. And the glottis is basically the vocal folds and the rima glottis. So the glottis is the vocal fold plus the rima glottis. And the reason why men have a lower voice than females typically is because the distance between the inside of the laryngeal prominence is since their laryngeal prominence is more pronounced and more facing anterior, it creates longer vocal cords on the inside. And so you think of like a bass. So the longer strings of a bass versus the strings of a violin create a deeper sound. So that explains why men typically have a deeper voice than women. So this is the model, and I've seen it pop up on the quizzes. And this view right here is the same thing we were just looking at. So this line right here is the vestibular fold, and the ligament is buried in that membrane of the vestibular fold. This line right here, the white one, is the vocal cord or the vocal ligament, and it is covered by this membrane here, which is called the vocal fold. And we're going to look at this model again when we do the bronchial tree. So we're moving down the trachea, and at the level of the sternal angle here, right here, the trachea is going to bifurcate into a right and a left main bronchus or primary bronchus. And it's the screen over here. And these are contained within the mediastinum. And then on the right, those main bronchi are going to give way to three smaller lobar bronchi. And the lobar are also called the secondary bronchi. There are three of them on the right and two of them on the left. So they correlate with the amount of lobes there are. So we'll learn that there are three lobes of the lungs on the right and two on the left. Kind of like in the heart where we have the valves, the tricuspid on the right and the bicuspid on the left. Kind of follows the same pattern. So smaller than even the lobar bronchi are the segmental bronchi or the tertiary bronchi. They're the yellow ones over here. And they do have names. You don't have to know the names of them. But at that point, we're starting to get embedded in the lung tissue here. So you won't be able to see those segmental bronchi if you were just looking at an intact lung.